Welcome back. State-of-the-art technology expected to assist in enhancing the delivery of patient care once the newly revamped National Health Insurance Plan is implemented. Here's Fern Carey.
Officials from the National Health Insurance Authority say new technology like the electronic health record will be used in a revamped National Health Plan when it comes on stream in mid-2020.
One of the challenges in healthcare here in making decisions and making recommendations to the government is the lack of data, the absence of information to inform those decisions, and the electronic health record is a critical part of that. So we've completed our procurement. We're in negotiations with the supplier now. And I hope that our lead group of physicians will have that in place by the middle of the year, and then shortly afterwards we'll have it across all of our beneficiaries. And we'll have something that will approach a national electronic health record, which will be invaluable to physicians and to those that manage the health system to get them data to make sure that we make decisions that are informed by evidence.
He says more people are also expected to benefit from the health plan.
We have just under 50,000 beneficiaries today. That number is going to grow, as I showed you on there, to about 170,000. We'll introduce some of those services to them earlier. This will enable us to, we're acquiring some technology, a claims administration system, an electronic health record. The health record, I think, we should be able to have into our lead group of physicians by the middle of the year. The claims system will be a little bit later. It gives us a time to sort of make sure that that's functioning, make sure that the training is done before we roll it out to all the insurance companies and a much broader number of beneficiaries.
Meantime, a new fee structure is also being developed for N.H.I. in order to ensure parity in pricing.
So we looked at each of the diseases. We looked at the population of the Bahamas. We looked at the prevalence of those diseases, how many people get them. If it was a cancer, we looked at what stage they presented, and we looked at what the care pathway was at each one of those stages, so how people are treated from that point. And then we looked at the cost of each one of those treatment events, and in effect said, there's a certain number of people we know will get it, there's a certain number will present at stage 1, we know what the cost of treating that is. We had cost data from the Public Hospitals Authority. We had to use some other data points to provide cost inputs from the private sector. We benchmarked it against costs overseas to make sure that we're in the region.
Fern Carey, ZNS Network News.